HIV and HPV Health Questions by Paul Davis, Cynthia Ramirez, and Michelle Romero. Co-created with Sexual Health Ambassador Mackenzie Martin. We are teaming up with the Center to question students on their sexual health knowledge. The series of questions are organized in a fact-or-myth manner and covers HIV and HPV. Do you know what the center is and what they offer? Do you guys know what the center is here on campus?
It's the center. It's like LGBTQ plus support. The women's center is housed there. You can get free condoms.
Do you guys know what the center is here on campus?
Like the wellness center?
Do you know what the center is here on campus?
Yes.
Okay. What do they offer? Do you know?
They offer. Oh wow, they offer a lot. Like they have a closet that has free clothing. That you can come and get stuff from. They provide, I think, the STD testing. They provide like tampons, pads, and condoms, and they have like a library full of like
Books.
books.
Yeah.
Mostly women, and people of color, and it's kind of just like a study place.
Fact or myth? HIV and HPV carriers always show symptoms. Fact or myth? HPV and HIV carriers always have symptoms. That's okay.
Myth.
Yeah, correct.
Myth. Both HIV and HPV can be asymptomatic. However, HPV spreads by having vaginal, anal, or oral sex with someone who has the virus. Most commonly spread during vaginal or anal sex, and it can be passed even when an infected person has no signs or symptoms. HIV can be transmitted through sexual contact, sharing needles to inject drugs, or a mother can transmit it to a baby during pregnancy, birth, or breastfeeding. The only way to know if you are infected with HIV is to get tested. The symptoms are flu-like and can be easily misunderstood.
Fact or myth? HPV is more prevalent than HIV. Fact or myth? Is HPV more prevalent than HIV?
Yeah, I think that's a fact.
HPV is more prevalent than HIV.
I'll let you take that one. Go ahead.
I wasn't healthy life skills. That's fact.
Yes, it is. Got it. Good.
Fact. According to the CDC, over 65 million people in the United States live with the incurable disease, and every year 15 million more people are infected. On the contrary, 1.2 million Americans live with HIV, and there were roughly 36,400 new cases in 2018.
Fact or myth? Individuals with HPV are more likely to contract HIV. If you have HPV, you are more likely to contract HIV.
HPV,
I don't have any facts to go behind.
I
So,
would say fact.
yes.
Fact. There are different types of HPV, particularly HPV 58, 70, and 31, are found to put individuals at a higher risk to contract HIV according to a study done by the USCF.
Fact or myth? HPV and HIV are close enough to almost be the same virus. So, myth or fact?
Myth or fact? HPV and HIV are close enough to almost be the same virus. Myth. Okay, myth or fact? HPV and HIV are close enough to almost be considered the same virus.
Myth.
Okay. Myth or fact? HPV and HIV are close enough to be almost considered the same virus.
Myth. HIV. Human immunodeficiency virus. A virus that attacks the body's immune system. If not treated, it can lead to AIDS, acquired immunodeficiency syndrome. HPV. Human papillomavirus. the most common sexually transmitted infection. Many different types, and some types can cause health problems, including genital warts and cancers. It can infect your genital area, your vulva, vagina, cervix, rectum, anus, penis, and scrotum, as well as your mouth and throat.
Fact or myth? You can tell when someone has HPV or HIV.
Myth or fact? You can tell when someone has HPV or HIV.
Myth.
Myth. Myth or fact? You can tell when someone has HPV or HIV.
Myth.
Myth or fact? You can tell when someone has HPV or HIV.
Fact.
Fact?
Myth. Infection with HIV occurs by the transfer of bodily fluids, including blood, semen, and pre-ejaculate, vaginal fluid, and breast milk. Symptoms typically appear 2 to 4 weeks after contact with the virus. Flu-like symptoms such as fevers, chills, night sweats, muscle aches, and swollen lymph nodes. However, according to the CDC, many people only experience minor symptoms. This is why testing is imperative. High-risk HPV doesn't have symptoms. Unfortunately, most people who have a high-risk type of HPV will never show any signs of the infection until it's already caused serious health problems. That's why regular checkups are so important. In many cases, cervical cancer can be prevented by finding abnormal cell changes that, if left untreated, could develop into cancer.
Fact or myth? Your sex life is ruined once you contract HIV or HPV.
Myth or fact? Your sex life is ruined once you contract HIV or HPV.
Myth.
Myth. Myth or fact? Your sex life is ruined once you contract HIV or HPV.
Myth.
Myth. Okay, myth or fact? Your sex life is ruined once you contract HIV or HPV.
Fact.
Fact.
Myth. HPV. There are preventative measures to stop the transmission of HPV. Vaccinations for boys and girls are available as early as the age of 9 and is recommended routinely at the ages of 11 and 12. Consent and correct use of a condom is also a way to prevent the transmission of HPV. In just over the last year, the FDA has approved the vaccine for adults up to the age of 45. HIV. Medication, condoms, and education can allow you to have a safe sex life. Pre-exposure prophylactics, or PrEP, is a preventative drug, and the post-exposure prophylactics, or PEP, is what you take if you have recently had sex and might have been exposed to HIV. These are just some of the medications that your doctor can recommend for a normal sex life. Abstinence would obviously be the number one way to prevent the spread of HIV or HPV. As long as you stay educated and communicate with your doctor, you'll be able to have a safe sex life.